Good morning and welcome to our 47th Coffee with the Commissioner event. It's a Wednesday morning, it's bright and early, and there's a lot going on in Escambia County and in Pensacola. And we're very fortunate to have some great guests here with us this morning on our live webinar. And so without further ado, I'm going to introduce each of my special guests. And again, this is our weekly Coffee with the Commissioner event. And typically we would go out to McDonald's or Hardee's or Denny's, and we would do this out in the districts and the neighborhoods of District 1 to hear about, your issues with, the roads, infrastructure, drainage, economic development, quality of life, parks, any stuff like that. But of course, we're in the middle of the COVID-19 pandemic worldwide. And as we all know, it's been in the news a lot lately. And so we're fortunate again that we have an expert panel of guests here this morning that we're going to discuss all aspects of this with them. This is what I like to call the brain trust of Escambia County. These folks are the ladies and gentlemen that run the three major hospitals in Pensacola area in Escambia County. So we have obviously Administrator Janice Gilley is here with us this morning to give us a county update. And then we have Mr. Mark Faulkner. He's the president and CEO of Baptist Healthcare in Pensacola. Good morning, Mark. Good to see you. We have Ms. Gay Nord. She is the CEO of West Florida Hospital. Good morning, Gay. Thank you very much for your time this morning. And then we also have good morning. And then we also have Dawn Rudolph. She's the president of Ascension Sacred Heart Hospital. And then we have Mr. Justin Labrato. And I apologize, Justin, your title is?
Chief Operating Officer of Ascension Medical Group.
Okay, Justin, thank you all for being here this morning. Well, as we typically do, there's typically week to week a lot that goes on in the county. I know this week there was a lot going on with testing and with the number of positives that we had within the county. So we'll start out just briefly with Janice Gilley, who would give us an update from the county. Appreciate you being here this morning.
Yeah, thank you for having us again. The testing sites are typically one of the things that I talk about. As I mentioned, I think last week or the week before, we had 81 ECAT drivers and staff and employees tested at the ECAT facility. As of yesterday, we still only had the original one positive that was tested at ECAT. And it is taking, I think, a little bit of time to get all the notifications out from the Florida Department of Health to our employees as to whether or not they tested positive or negative, actually, because we were told that through contact tracing, they would be told pretty quickly if they were positive. So the good news is 2 weeks later, we're going to be able to go back to our previously modified route for ECAT, which will be good for folks. We had, severely limited the transportation to just morning and afternoon so that folks could get to and from work. So that's good news that next week we can go back to that modified schedule where we still have the 10 on the bus, we still have the social distancing on the bus and things like that. We have also had 6 of our lifeguards test positive. Most of them are the relief lifeguards, so they are not necessarily curbing our ability right now to be able to provide those services on the beach. It's kind of a good news, bad news in the sense that the good news is they were kind of 2 groups of 3 that were kind of together and out. And so the contact tracing was pretty easy to be able to manage from that perspective. And so we do know that they did not necessarily contract it from being around the public. And I think that's also one of those good news, bad news things. Bad news, they have it. Good news, it wasn't something that they contracted as they were doing their job with the public. Community Health Northwest is going to try something a little different today. They're going to start doing their testing on their at Jackson Street. And so, trying to manage the traffic around that area. As you know, it's a little tight. And so I think we'll see how that goes for them. And then, that most of the other sites like the UWF and others, they are, because they're outdoors, they are weather permitting. And so, we just continue to ask for people's patience. We know that there are long lines. We know that they sit out there for a long time waiting for their test. But, as we're getting into the summer months, we do have those afternoon storms. So if there are still tests available when the storms come through, they may be shut down because of weather. We also know that they are shutting down a little bit early right now because of running out of tests.
Yeah.
And so that's something that I think your panel can speak to. Tomorrow at the board meeting, we are going to have Dr. Lanza come and provide an update to the commissioners, just from his perspective. We also plan to have Eric Gilmore come and discuss any information that he may have related to the Blue Angels, which is next week. We did have a planning meeting last week with all the with the Island Authority and all of the law enforcement officers from FWC, Highway Patrol, all the different entities that are engaged whenever you have a large event like this. And as you all know, we've tried very hard to make sure, or the Island Authority and the Navy have tried very hard to make sure that this event is spread out so that we can definitely social distance. And then the last thing I'd just like to mention is that starting this morning, we do have radio ads that are starting up this morning. Escambia County has started a public health campaign just to reinforce that we would like you to mask up, follow the CDC guidelines, follow the 3 C's of, making sure that you are not in a closed confined space with folks, the ones that the governor mentioned this past week. So we are trying to make sure that we reiterate that and just ask folks to, be considerate of others and follow those recommendations.
Thank you very much, Janice, for that. And, something happened late yesterday afternoon, so I'm going to jump right in with the panel that's here. We, after 4:30, I think was when I got it. I got a letter. I received a letter signed by 3 of you all that are here with me this morning. So it's great because I want to ask for just a little clarification on it. Obviously, the message received, and just for everyone who's listening, it is a letter that was addressed to each member of the Board of County Commissioners. And I guess the flavor of it was urging the public to wear masks in public, and urging it's sent to us. But now I'm going to ask you, I'll start with you, Mark. I'll put you on the hot seat. In there, you've stopped short of calling on us to enact an ordinance. Was that by design, or do you believe we should enact an ordinance?
Well, I think, first of all, we're just being asked in the community and by media, what's our position in this? And our position is consistent, as has been, with the CDC guidelines that have evolved over the past few weeks, and that is a strong recommendation of wearing masks. That also was echoed by the Surgeon General just last week. So we're trying to stay within our swim lane, and that is provide advice and counsel and guidance with respect to what's happening and what is effective in terms of curbing the community spread that we're seeing, and leave it to the policymakers to determine how we go about issuing that level of urging or mandate or whatever we want to pursue.
Yeah, I appreciate that. Now, I know in contrast, you all signed a similar letter back in March regarding the beach. And so, Gay, I'll flip this to you next. When that letter was signed, it was a little more, what's the word? It was a little more clear in what you guys were asking us to do. At that point, the message in that letter was, hey, we would like to see you close the beach, and here's the reasons why. And of course, at that point, we had our sheriff come to the meeting, and he didn't come out and say, hey, do it, but he was pretty strong in his support for that letter, and that led to, of course, what happened. But Gay, this letter did not say that. This letter seems to be just an admonition to the population, to follow the guidelines, which I support. I mean, I'm strongly in support of that. Do you think we ought to have a rule, a law, to force people to wear the masks?
So as you mentioned, the letter is not us actually mandating masking, obviously, but we are strongly encouraging based on the science. And, we are in healthcare and we see this every day. And so the letter is really just to encourage and ask the commission, obviously the city of Pensacola has already done so, to encourage citizens to wear masks. The evidence is out there that it works. I think much like closing the beaches, we do all feel like the curve was bent at that time. Now that things have opened back up, we want to err on the side of caution and make sure that we do encourage our citizens to wear masks. We are universal masking at our hospitals. It's a proven science, and I think we all are behind it. And we would again like to encourage all to mask.
Fair answer. Dawn Rudolph, is that about your sentiments as well, or do you have anything to add to that part of the discussion? The letter didn't specifically say we want you to enact an ordinance making this mandatory, whereas the previous letter in March was, hey, you've got to close the beach and this is what we want you to do. Is there some reason for that nuanced distinction between the two letters?
I appreciate the question. I think Mark and Gay answered it quite well, and I concur that that it was different back in March. In fact, I was just looking on the CDC website this morning. I mean, the evidence that has come in since March, the papers that have been published, we know as a healthcare community, scientists, more than we did in March. So the idea was to flatten the curve. That was our hope. And I also want to add our personal protective equipment. I mean,
yes.
we
Yes.
were a little unsure of, what the future looked like. And we looked at our reserves and said, we need to, prepare and plan. And that's what we did. We stopped our elective surgeries. We did everything possible to prepare for today, knowing that COVID would be with us. And so I think it's a different time today. I think we have more science, we're more prepared, we have our stores for personal protective equipment. So I agree with Mark and Gay. The
Okay.
spirit of the letter is to just provide a position.
Okay, well, very good. Of course, I've had a lot of opinions. I get them all the time. I go to Walmart to shop. I get opinions. I get people calling. I get people stopping in my office at work. One thing I want to say, this came out in Rick's blog yesterday. He's absolutely right. NAS Pensacola has a very strict masking requirement, and it started early on, and they've really jumped on it, and compliance is mandatory. And I'm a contractor, civilian contractor employee out there. That's my day job, what I've done for 15 years. And we all follow that law to the letter. When I'm in an area where I cannot socially distance, I wear the mask. I've got a total of 5 masks. And the thing that concerns me, and the thing that continually worries me, and I want to ask you because you're the experts, is the masks. One of the masks that I use is supposed to be a single-use surgical mask, but there's still a difficult time. The average citizen, I have a hard time getting PPE. I mean, you go to Lowe's, Home Depot, you go Walgreens, you can't find N95 masks. You just can't. And if you can, I'd like to know where, and I'm going to go buy more because I'm down to 4 of those left at my house. So if you can't find the masks, how are citizens supposed to, make this work, especially an effective mask like an N95 mask? And I'll start this time with you, Gay. What would you tell the citizen if he can't find the good masks that are effective? What should they do?
The latest guidance from CDC that actually it just came out. I think, in fact, Dr. Lanza sent that out earlier this week. Is an alternative would be cloth. Mm-hmm. So cloth mask. I mean, you see people with bandanas. So as a contingency, cloth certainly would be acceptable and certainly better than nothing.
Okay. And Dawn, let me ask you the same question. If I'm a guy who I want the most effective thing I can get, and in reading about the actual size of the particle of the coronavirus particle, they say it's 0.1 micron, but these bandanas and cloth masks, they don't stop anything that small. In fact, I've heard it said that it would be like a chain link fence being used to stop mosquitoes. Is that an inaccurate characterization?
I think people have characterizations. I would tell you from my experience that, I have my mask. This is what I use, the loop mask. I think you can get it at CVS. I work in a hospital. I go up on the units. This is what I wear, and so I'm not even fit tested for an N95 because I'm not in an environment where there will be aerosolizing positive COVID patients where I would have contact more than 15 minutes like our nurses. So, I think there's layers of safety that we want to consider. In your car by yourself, you may not need to wear your mask, right? But when you're, the social distancing, going into public spaces, that's when I feel this is your best protection right here. And if you don't have access to this, then it's the cloth covering that is acceptable.
Well, and back to the base, for instance, they are strict in the way they enforce it, and they of course have the Navy, police, the shore patrol. They have obviously people that work there have a commanding officer and a hierarchy of structure, and it's from the top down, and it is enforced, and it's effective. The thing that concerns me is the enforcement, and I'm probably bordering on the political. So if you don't want to weigh in on this, by all means, please say so. But I would just be curious your take. About half of my constituents don't want me to do it. I'm getting passionate emails saying, please don't make me do this. And the other half, I'm getting people to say, hey, please do it. It makes sense. So to me, a critical aspect of this is enforcement, though. What I've heard on the radio and in interviews is that the police in general don't want to be the mask police, for lack of a better word. They want to write tickets for folks. So if it's not going to be enforced, is it still effective? And we'll start with you this time, Mark.
So a couple of things. First of all, coming back to the mask, N95s are the standard. They do protect both ways. Surgical mask is the second best. Third is cloth mask. And it's true, you're trying to stop a mosquito going through a chain link fence, but that mosquito is riding inside of a softball. And what you're stopping is the droplets that contain the virus. Okay, so that's where the efficacy comes from. Is the fabric does protect that droplet from entering into the air, which has been proven to be the most likely form of transmittal of the virus. Coming back to the mandate, we have considered and enacted ordinances that protect public safety, and sometimes they go against civil liberties.
Sure.
An example might be the Clean Indoor Air Act. Okay, we all have the right to smoke a cigarette, but it's been proven that secondhand smoke does cause cancer. And there was a tough decision years ago. You recall that? I recall.
Oh, yeah, I
it.
remember.
And there were plenty in favor and plenty opposed. But at the end of the day, it was determined that the public health is in the greater interest of the civil. You can still smoke your cigarette in your car, or your home, your porch, wherever. And yet, the transmission and the acquiring of cancer through secondary smoke is so low, but it was still determined to be enough to change the law. What's happening in this pandemic is much greater in terms of, in my perspective at least, the risks that exist with the transmission of the virus. Now, whether or not it's a mandate or not, I think like in March when we wrote a letter saying, give us 2 weeks. Let's see what happens. Let's get PPE. Let's get testing ramp up. But give us 2 weeks. And we moved rapidly in that direction. We're seeing other municipalities in the state of Florida enact mandatory masking. Jacksonville, Tampa, Miami, Key West. I think it would be prudent for us to look at the data. What happens over the next week, 2, 3 weeks, to see if mandating has an effect. If it begins to bend the curve, perhaps if we do or don't mandate here in our community, we watch what happens, just like we did in the first wave. We learned from Dade County. We learned from Hillsborough and Duval. And we were ahead of the curve, and we stayed ahead of the curve. And Pensacola did phenomenally well in bending the curve here. If it weren't for the congregate living, we would have had a minimal outbreak in the first wave. Now we're seeing a different story. It is community spread. So let's look at the data. Let's look at the science. Let's look at what has happened or is happening or will happen in these other areas in the state of Florida.
Well, and that's one thing that I said when I was speaking with Channel 3 on the issue 2 days ago. And I said, you know, I'm a guy who's very curious. I like to ask a lot of questions. I was very fortunate to have you all, each of you all on this before. We've talked about COVID. And I actually had Dr. Lanza on one of my first coffees in late March, and we talked about this. And I'll throw this at you. And I know it's evolving and things are changing, but on that particular day in March, late March, I had a commenter online say, hey, listen, I work at a grocery store and I'm freaked out about this. And I'd like to wear a mask for protection. And my boss won't let me. Can you imagine from 3 months to this? And I said, what should I tell her? And Dr. Lanza said, well, listen, you know, the CDC does not believe that you should wear masks for protection. They're for people that are sick to keep them from spreading. And that was my whole experience with masks. I lived in Japan for many years, and people wear masks when they're sick there. It's a courteous thing to do. But I was shocked by that answer. In fact, if you go back and watch that video, but I know a lot has changed since then. So precisely what has changed? Because my question, again, I'm going to throw this one first to Dawn, so be ready. You know, Dr. Lanza is a great guy. I have tons of respect for him, and been in the business many, many years. And I intend to have him on another coffee as well soon, if he'll come. But to be in that business 35, 40 years and dealing with lots of similar, not the same, but similar types of infections and diseases that are communicable this way, for that guidance to be that for 35 years, that sick people wear it only, to suddenly change over 90 days, that's really been a mixed message that's made it difficult for the average citizen to kind of get their arms around it, you know.
Yeah, and myself as well. I guess I would offer, I think what's been intriguing to me from March to now is this increase in the asymptomatic, where we're hearing, you know, fever. We're so worried about fever. Did you travel internationally? You know, the transmission of the virus. Now we're hearing, and I'll have Justin concur when he's doing his navigation out of the testing center. What people are saying is, I just had a lack of taste. I had sinusitis. Well, for me, that's not being sick. You know, that's just having common human, you know, allergies or something like that. But I think that's what we're finding, is that it's not the traditional sick. And so if you wear your mask, and when I go out and visit my parents, you know, I haven't seen them for a while. I'm going to wear a mask. I don't feel sick, but I could be carrying this virus. And I think that's the spirit of that message, to mask up, is that until we know more, what does it harm us really to throw this on so that when I'm across from the public person in Publix, that I'm not bringing something into that store until we know more. And that, I think that's the spirit of the letter.
Okay, Justin, I'd like you to weigh in on that. What is your experience? I mean, in what you do over at Ascension Sacred Heart, what's your experience with the masking issue?
Yeah, so, we've been community testing for 16 weeks, and I'll say masking is effective, and I'll tell you why. So 2 weeks ago, I had my entire testing team take the antibody test, and they came back 100% negative across the board. So my team has had 1,100 positive patients come through our testing site. And to me, that shows, and I told the governor this on Sunday, I talked to the mayor about it. When I can go and look at Alan and Latoya and Kelsey and Hardy, and they've been well for 16 weeks because they've used masks and the proper PPE, and they've seen more COVID people in front of them, right? I mean, they're touching them.
Right.
It just shows me that it's effective. And I didn't have that firsthand experience 17 weeks ago.
But Justin, now the average person watching that, and I'm going to play devil's advocate, please don't take this the wrong way.
Yeah.
You're going to say, well, but your team, has the full astronaut suit, whereas I'm wearing a bandana because I can't find a mask in the store. So is that really a logical conclusion to come to, that your guys are safe, but they have the complete, the face shield, the mask, the second mask, the gowns, the whole shebang. Whereas the average guy like me, I can't even find an N95 mask. I got to take the same one off the rack and use it over and over. And then I'm touching it all over the place. And then it, and you guys are using single use as well. I mean, I'm sure those folks, they use it, they throw it away the next patient. Don't they go through this stuff pretty regular?
They do. The N95s they can wear until it's compromised. So it can go 2 or 3 hours on the N95. But I'll say, like myself, I've been out there, I don't know how many times, 20, 30 times, and I'm wearing a surgical mask, and I'm 10 feet away from these patients. And I was also negative for the antibody test. So, and I'm just using the normal surgical mask. So the people that are actually swabbing, yeah, they do have the N95s, but I'm that normal distance away. Like if you're walking by someone in the supermarket or on the street, I'm that 10 foot, 20 foot away, and the surgical mask has been very effective.
Well, I mean, we've talked a lot about masks, and it's as of right now, Janice, that is not on our agenda. Is that correct?
You're talking about the mandating
the discussion of masks.
I have not seen an add-on. That doesn't mean that one wouldn't come today.
Okay, yeah. I have a sneaky suspicion there will be an add-on. I have a feeling we'll be discussing it on Thursday.
I did want to mention something about masks. So
Yeah.
part of our public health campaign that we'll be announcing tomorrow with you all is that we are going to be providing masks at our community centers and our libraries.
Can I get some? No, I'm kidding.
Yeah. So, but I do think your question is an exceptional question in the sense of, how long do they last? And, we know that the surgical ones aren't really washable. And so I have noticed, like myself and others, I'm keeping them hanging. I have 2 masks, a cotton one and a surgical mask that I leave hanging from my, rear view. Yeah, mirror.
Seen a lot of those, yeah.
And, but so we do have surgical masks that we can hand out. So no, we don't have the N95s. And so, one of the conversations that we've been having is when you hand them out, if they're one-time use, I mean, we won't have enough for every family in Escambia County. I mean, we started looking, for every day for months and months, the surgical mask. And so that's been part of our dilemma, is trying to figure out how many you could provide. If somebody came up and said, I need 30 to get me through the month, that's going to be difficult to manage as far as the distribution of them. We have had a couple of other organizations contact us that we are hoping to get maybe another 50, 60,000 masks next week. So hopefully that announcement is going to come through. And then we also have had to make sure that we have held a certain number of masks for hurricane season, for sheltering,
Right.
and also in case there are a lot of outbreaks in the congregate, or the assisted living centers.
Right.
We also want to make sure that we are holding back appropriately for those facilities. So, it's been a very difficult balance in the conversations about how to make sure that we do properly provide them to our citizenry, but also protect ourselves for, unfortunately, as we continue these unknowns. So we are going to have some, and they are going to start being distributed. We are also looking to provide some other sanitizing items. We have had hand sanitizer, the 2-ounce bottles on order, unfortunately, for about 6 weeks. But we are doubling that order to make sure that when they do come in, we will have some, to hand out with the mask. We're also probably going to get some bars of soap. I know that may sound simple, but on the other
Back to
hand,
basics.
we want to encourage folks to make sure that they have, maybe their own little bar of soap that they keep with them as they travel. And we are also looking for small packages of wipes that they could keep. I mean, our message is the same, which is please try and stay clean and stay sanitized, and then also try and protect yourself with a mask.
Okay. I appreciate that. And I'll be looking forward to that announcement. I'll probably pick up some masks as well, because I look every week. I shop at the same store every week, do the shopping, the grocery shopping. I look for rubbing alcohol, can't get it. I look for sanitizer. Occasionally you get these tiny bottles for $4. I mean, they're really tiny. I buy a couple because, I just want it. I look for even refills for foaming hand soap. You can't find it. I mean, some of this stuff, the supply chain is not caught up. You talk about the Clorox wipes, you can't find it. N95 masks, forget about it. You're not going to find them. So, I think that becomes an issue. And so I hate to spend this entire first segment talking only about masks, but it's a big issue. And of course, I greatly appreciate this panel being here this morning. And I want to go ahead and reintroduce everyone. We've got Justin Labrato here from Ascension. We've got Mark Faulkner here, the president of Baptist. We've got Gay Nord here from West Florida Hospital. Of course, Don Rudolph from Ascension as well. And so this is the brain trust of the hospitals in our area. And again, I appreciate each of you being here this morning, along with Janice Gilley. So final thing on the masks, and we'll start with Don, and then we'll go to Justin and around the room. If we go, if by chance it's voted and it's mandatory, what would you say to folks who are not wearing them properly? I mean, because to me, if you're walking around, I don't want to name the guy, but I went out to dinner recently, and the waiter was wearing a mask, but when he came to the table, he took the mask off, and we're talking. And I'm thinking to myself, okay, here we go. And then I looked around the room, and I'm, a guy that looks, people watches. And so some people had the mask below the nose. Other people had them off, hanging off the ear. If they're not worn properly, does it gives people the false sense of security, a false sense of safety? I'm getting a couple of questions about that. Is it giving folks does it emboldening people to maybe go out and be with people, and it's actually hurting them more than helping them? And I'll start with you, Justin.
Sure. I have seen multiple people wearing the mask below the nose, and I have no problem telling them why I think they need to cover up. So we've been around our organization, we've been talking about 200% accountable. You take care of me, I take care of you. And we're actually having those conversations with people if we think they're doing things improperly. So you have to cover your nose, you have to cover your mouth, and don't be shy to tell people. I don't think it's offending anybody, telling them our opinion.
Yeah. Well, wait a minute though. I'll wait till after my food gets delivered before I tell the waiter, right? I don't want a problem. I don't want a different problem, right? Okay. So Dawn, what's your thoughts on that?
I appreciate the 200% accountability comment. I mean, we do that a lot when we're around. We have universal masking. We'll be like, get it up. Not here, it's here. But I take it off to talk every once in a while. Again, it's all these layers of safety. It's the hand washing. It's the social distancing. If it's 2 minutes of a conversation I need to have, I can take it off and put it back on. I'm otherwise healthy. So my level of risk is a little more tolerant. If I had asthma, if I had a condition, I would say, hey, 6 feet away, buddy. I would be much more like, get out of my space. And so I think it's a civil type of approach of how we live in community together, that I'm going to bring my bags into the grocery store. I'm not going to reuse plastic bags. So I'm going to reuse my mask. I'm not going to throw it away every time. I'm going to participate in being part of this community in the way that's comfortable for me. And if it is leaning in and wearing a mask in businesses, that's what we'll do. And if I actually said something, I have one in my purse. I mean, I'll be like, hey, you might want to, put this on sometime, and, just approach it in a nice way, and in a way of, hey, I am from Sacred Heart. Here's a mask, and let them make that choice. But I think, it shouldn't be adversarial. I mean, we should be understanding, and we should be compassionate, and we should be in this together.
No, I that's a great answer. All right, guys, we're going to switch gears now. I'm going to start with Gay Nord. I appreciate everyone's patience as we go around and questions. And I want to ask a little bit about your hospitals specifically, about how they're handling, the cases locally. And then I'm going to talk a little bit more and ask questions about the census. But I guess I'll start out with, and we'll start with you, Gay. Do you have enough PPE, medications, I heard there's a medication shortage going on. Do you have enough ventilators? And importantly, do you have personnel? I had a guy text me an announcement for RNs, $75 an hour temporary. They were screaming for help. So how is West Florida? How are you handling those 4 issues? And what's the shape of West Florida Hospital?
So from a PPE perspective, the supply, in particularly for hospitals, I think it's definitely, as of now, caught up with demand. So, PPE, good supply there, continue to get supply in. From a equipment perspective, medication perspective, we are not seeing any, on the medication front, we're not seeing any severe shortages there. We've got adequate medications to take care of our patients. On the staffing side, obviously this whole conversation has been about community spread, concerns around precautions that we're all taking. What happens out in the community clearly directly affects what we do every day to take care of our patients. From a staffing perspective, we're still in good shape. I will tell you that we do have concern, and I think this conversation's been great, and that concern obviously is around the spread. We need to make sure that we take every precaution possible, because at the end of the day, we have to be able to take care of our patients and our community, and our employees are a part of the community. So it's kind of my public service announcement around making sure that we are also thinking about that as we think about the safety of our community. For really everyone that takes care of our community, but in particularly the hospital staff. So we are really green, as Dawn always says. We're green on all of our indicators related to our ability to support our patients and our community at this point.
Fantastic. And Mark Faulkner, Baptist Hospital. I heard on one of the sites, I think it might have been the News Journal or it might have been Rick's in weekly blog, that you were down to like no ICU beds at Baptist. Is that it? And that leads to another question that I'll get to next. But but I'll ask you the same question that I asked Gay in terms of PPE, medication levels, and ventilators and personnel. How's Baptist doing?
So yes, PPE has improved with the supply chains caught up. We were in pretty good shape with PPE. Testing, still not as much availability as we'd like. We had our weekly allotment for our Cepheid platform, which is very limited, much less than we need. So that's still pretty tight right now. I'd like to see more. It's really the reagent supply. But we're, again, each week trying to get more and more to expand our testing capability. Staff is the concern. As they get exposed, perhaps in the community, it will begin to impact our ability to provide care. Ventilators, we're in pretty good shape right now in terms of managing the patients that are on vents today. So we certainly have an adequate supply there. We'll talk about census and beds, I guess, in a minute. But yeah, we're green, but certainly paying close attention to all these factors.
Very good. Dawn and Justin, I'll let which one of you all want to answer for Ascension, but the same question. Do you have enough PPE, medications, ventilators, and personnel? What's your status at the moment?
Yeah, I appreciate the question. I'll take it, Justin. For the hospital, I would say we're very proud to be part of a national health ministry. So from a PPE standpoint, we got geared up pretty quickly. Right. And so we're green there. Our census of COVID is typically been less than 1% of our patients. On any given day, we have 400 people in our hospital, and so less than 1% being COVID is very manageable for us. We have a deep bench with our associates and their skill sets, and be able to flex and move to meet the needs. We did see hospitalizations jump from May to June. So, as Mark said, that's something we keep an eye on, but still less than 5%, are on our vents. So, less than 5% of our patients are COVID patients. So we reopened for business. We're seeing all of our elective surgeries. We're testing them ahead of time. And I think that's been the stress on our system, is the demand of the testing for our elective surgeries, as well as for what we call our pre-admission testing that Justin helps us manage, as well as the community testing. So I agree with Mark, getting allocation for Cepheid. We can do 1,000 tests a day if we have allocation. If we don't, then we use a different platform that is smaller batched, and it takes a lot more labor because it takes longer to run the test through to get to the turnaround times that we've been trying to provide for the community. So there's multiple variables on any given day to make sure that we stay green, but it's manageable so far. And again, just keeping our eyes on, the trends.
Well, one of the things that we see in the news every single night is they show these hospitals that are overrun with patients. Typically right now it seems to be Arizona and Houston, Texas area. They're having the acute issue. And so I'm very happy to hear from the heads of our hospitals that we're not there. But one question about census, and this might border on the political, but I think it's an important metric. Early on, one of the important metrics that I wanted to know was bed availability and ventilator availability. And we got that put into our daily sit rep, and we appreciate y'all telling. But now that it seems like the ventilators are not the treatment du jour anymore, they're doing different things or whatever. So, but you mentioned, Dawn, about your census numbers about COVID. And so I saw one of my peer county commissioners from South Florida, Christian Ziegler from Sarasota, has a thing that he independently manages. I love it. And I'm contemplating doing something very similar here if I can get the numbers, and they might be out there, I might know, but what I'd like to know is, could we have the census data and based upon the total number of cases, but then broken down by the number of cases that were COVID, like in other words, number of beds occupied and the percentage, and then the number of COVID patients in beds and the percentage, and then the number of ICU suites available, and then the number of the percentage, and then the number of ICU suites utilized by a COVID patient, the percentage. Because I think what happens is folks are conflating what they see on the news with the realities of what your hospitals are typically. I know you don't make money with an empty hospital, right? You can't pay the bills, right? You got to have a certain number, but they're seeing this, and in their minds, they're conflating these overrun hospitals with you guys being overrun with COVID patients. But I'd like to know, is that something that you guys could provide? That way we would know. Because what I can see from our dashboard is we've had about 86 hospitalizations since the start for COVID. So anyone want to take a crack at that? Justin, you want to take a crack at that? We'll put you on the spot.
I do not want to take a crack at that.
Hey, fair enough.
I think it's a fair conversation. I mean, there's a reason why we have 40 ICU beds, because the demand, we're a trauma center, we're a regional tertiary care center. There's demand in our service area that's far more reaching than Escambia County. So, there's a view, I think, of hospitalizations from the state, and that's what I would direct you to, because they look at it from a county-wide view. Mm-hmm. So that's where the data can get either conflated or confounding, however you want to look at it, because we take care of patients from multiple regions. And so, just to pare it down into Escambia County, takes a lot of data definitions, so that we're all trucking along the same way. So I would pitch it out to the state, because they have, we report everything. And so they have the resources to be able to slice data in a way that might be helpful for you.
Well, I mean, again, I think it's helpful for constituents, because I do believe that the media, it's sexy to sell these times of stress, and they love it. I mean, it drives people to watch the news that maybe typically don't even watch it, but then they get a small glimpse of what's really going on. They don't get into the deep conversations with people who are on the front lines. And so they think, oh my gosh, we're like Houston, we're like New York was 3 months ago, but we're really not. What I'm hearing from you guys is it's a small number of COVID patients. I mean, you said about 5%, Dawn. Mark, what would you say in Baptist Hospital? What would you say, back of the bar napkin, what's the percentage of COVID patients taking up your space there?
Probably closer to 8 to 10%, and about close to a third in the ICU. You mentioned we had 0 ICU beds yesterday. That's probably still true today. That's not unusual. Hospitals have to run at near occupancy. We've had constraints for our critical care units for years. That's one of the reasons why we're building a new hospital. And we have to manage that, because what's in our ICUs are people that had open heart surgery, or they had neurosurgery or thoracic surgery, and they were planned to have some critical care stay, plus the traumas as a trauma center, plus now COVID. I think the way to look at this, there's been a lot of rhetoric around, we're going to gauge our public policy around hospital capacity. And that makes sense. I get it. We don't want to overrun the system. We certainly don't want that as providers either. But I think I would rather look at it as prevention of harm for anybody that can avoid clinical consequence, whether it's hospitalization, critical care, or death. Mm-hmm. And to say that, hey, let's rev up, let's go back to where we were because we have hospital beds. Still 2.3% of the people that get it in Escambia County pass away. And so
say that number again.
2.3. We've had 45 deaths out of 1,900 people that have been positive in Escambia County. So people are dying. Okay. And so I look at it not just, we are concerned about capacity. We are interested in managing the spread, but we're concerned about people who are contracting the disease with a bad clinical outcome.
Yes.
Okay?
Yeah.
And to say that let's just pay attention just to hospital capacity and decide what we're going to do. We still need to be conscientious of the spread.
Yeah.
That'd be no different than saying there's still empty plots at the cemetery. Let's go. No, that's not how we're looking at this.
Right,
we're very concerned that it's a strange virus from people that have no symptoms whatsoever, that are positive, mild symptoms as Don was describing, that barely know they have anything, but they are spreading to those that rapidly crash and pass away.
Yeah, that's a scary.
It is, and it's real. We've got a 41-year-old in our ICU, a 51-year-old in our ICU, a 29-year-old in our med-surg floor. It is the 80-somethings and 90-somethings and 70-somethings that are getting sick, but it's also affecting everyone.
Mark, let me ask you, those three, the 51, the 40, and the 27, were those with COVID-19?
Yeah.
Wow. Okay. That brings it home. I mean, because what we're hearing, and obviously we saw in the governor's press conference over there at Ascension over the weekend, that I believe the numbers, 85% of the fatalities were age 65 or older. And, obviously we don't want to hear about anyone dying, but if you're a young 25-year-old, I think that, unfortunately, that emboldens you. Like, I don't got to worry about this. You know what I mean? It almost counterproductive. I don't want to say that, but it's interesting. And I know here locally, a high percentage of our fatalities are from the long-term care facilities. I mean, so it's unusual for the 25-year-old triathlete to get this and die. Is that a fair statement? I mean,
it is absolutely a fair statement, and that's
the news. But the news media would have you believe that's what's going on, and that's the issue. So, Gay, I want to kick it back over to you. What if you had to guess? So we got 5%, we got 8%. West Florida Hospital number of COVID patients taking space.
So currently our census is running, as Don mentioned. We've obviously seen an increase with the community spread. It's about a little over 10% of the total patient population here now, and like Mark, it's about a third of our ICU. As well. And I would also say, I think there is a bit of a misnomer around the hospital capacity. And as my colleagues have mentioned, our ICUs tend to run close to capacity anyway. We are constantly monitoring, moving patients through the system. But we also have backup critical care beds.
Yes.
We've got contingency plans. So I think it's hard to just look at this at a point in time and say, Baptist or West Florida or Ascension only have 3 ICU beds open currently. It's really not that simple. We do this every day. We take care of critically ill patients, and we are often having to exercise our contingency plans, even pre-COVID, on a day-to-day basis. So to give you a little bit more reassurance around the bed capacity, I think that's also something that people need to take into account. And as we've talked about from day one, we have very sophisticated surge plans. We have very sophisticated contingency plans that we would even use in a non-COVID environment.
Well, that's good to know. It's reassuring to know that you all each have your surge plans and excess capacity if needed, if necessary. I want to move a little bit now. I know you guys are the ones who run the administrative side of the hospital, but I do have a question about what I'm hearing, and I think Mark touched on it a minute ago about the asymptomatic spread. This is what concerns me, because if you are healthy and you don't have, are you seeing patients who are healthy, who are not having a temperature, no symptoms, but are testing positive? And part 2 of that question is, are those patients contagious? Who wants to take a stab at that? Uh-oh. Okay, then let's ask Dawn. Sorry, Dawn, you're smiling, so I said, let's ask Dawn.
Well, I was thinking about that because, they're not going to be in the hospital if they're not sick.
But they're going to the testing sites, though.
Right. So that's why I was kind of smiling. Like, we're not going to see patients in the hospital bed that hasn't, have a reason to be admitted to the hospital. We wouldn't admit you because you're just COVID positive. You have to have an admitting diagnosis to be eligible or to qualify for an admission within the hospital. So, I mean, I think I would maybe reframe the question a little bit, if you allow me to say, what I'm worried about the asymptomatic spread is, our associates. They go out into the community, like, Gay said. And so as we're living our daily lives, coming in and out of workplaces, not just the hospital, but any workplace, from an employer view is, if this is spreading and then, they don't know they have it, or they're with a family member that doesn't know they have it, how do we manage that? How do we quantify that? And so I think we know that people are testing positive and they have very mild symptoms, or things that we wouldn't traditionally associate with a virus and flu. And so that's where this masking idea comes up. And, how can we help mitigate that?
Well, what I see on the dashboard this morning, and before I came in this morning, I went to the dashboard and checked it. We've tested, in Escambia County, we've tested 33,469 residents, which equates to 10%, a little over 10% of our population. We've had 1,952 positive tests, a total of 93 hospitalized since March, since this, with COVID. And then of course, a total of 45 deaths, which is tragic. It's terrible. But with that level of testing, if we extrapolate, I think it's 7.8% positivity now, or very close to that. Do we really have 21,000 people? I mean, would you make that leap and say, well, we probably have, that's probably community wide? No. How would you, people want to know, should we all get tested? Mark, should we all go get tested?
We have the capacity now at UWF to test people that aren't symptomatic. Of course, in the healthcare providers, we typically screen those for only the symptomatic patients. And so, yeah, I would encourage, if you've had a risk exposure, perhaps been out in the community or been in touch with somebody that has been positive, I would certainly encourage everyone to get tested. We model the data. If we look at what's happened since this began and the numbers that have tested positive, and you assume a 2-week recovery period, and as they come on and they come off the roll, so to speak. Right now, we're probably, in our 2-county area, probably have close to 1,000 or more that we know to be infected and positive and today and contagious. Whereas that number was dramatically different back in March and April.
Right.
So we've seen this, and then we've seen this. So this is what's happening right now. CDC the other day said, it could be as many as 10 times the people that are confirmed positive that actually have been exposed, have been positive for COVID at some point. I don't know that we have data that supports that yet, but we do know, we assume that there are those that have been positive, are positive, that didn't get tested, don't know that they're positive. So the number's at least that. And growing. That's the concern, back to Dawn's point. You don't know you have it perhaps. And so you wear the mask to protect others. You stay 6 feet away to protect yourself.
Great answer. Gay, let me ask you the similar question. If I work in a small office, say with 10 employees, and say one employee tests positive, do we shut down the whole office? What's the guidance? The latest guidance on that? Do we shut down the whole office and sanitize it? And do we each self-quarantine if we've been around a person who's been infected? What would you say to someone in that circumstance?
So the policy, and this is evolving and changing. So I would preface it by that comment, but definitely, shutting the office down, clean, doing what we call a terminal clean, absolutely, positively. Closing the business down and having people quarantine, not necessarily. What we tend to do, it depends on, and I don't want to get into all the science and technical details of this, but there's true exposure and there's contact, and they're two very different things. So if you really feel like you have been intimately exposed to a positive patient, you're going to take a very different route than if you've just been in the presence of someone who was positive. So I think masking and very closely monitoring any symptoms among those other employees, and even testing, as Mark said, that testing is not a bad idea if you don't have symptoms and you can get tested. I will also add to that, this is the the complexity of this virus, testing is a point in time. So you can test on a Monday and be negative, and something have happened within the next week and a half that you may be completely unaware of, and test a week and a half later and you're positive.
Wow.
So, so the testing piece of this is very, very complicated. We talk about this every day in the healthcare world, what makes sense. I mean, we've had recommendations to test everybody, every patient, every employee. And again, it's a full circle discussion because it's a point in time and it's not a safeguard, from the virus itself. So in the small business environment, in the scenario that you just described, I would say definitely cleaning, masking for those non-symptomatic employees who work in the business, and just monitoring, have them self-monitor very closely. And if symptoms arise, what we're recommending is definitely testing.
Very good. Oh, I appreciate it. I know that's kind of a loaded question, but there's a lot of small businesses that are probably struggling with exactly what
Right.
I see on Channel 3 now, that there's some restaurants that they're not disclosing when they have employees that have tested positive. I mean, it is like you guys have said. Well, the one word that I think we use is it's evolving. I mean, the whole thing's evolving. I've even heard now that the virus itself is evolving and mutating into a less lethal strain. In fact, there was an article in, I want to say it was the New York Times that mentioned that. Do you guys, has anyone heard any of that it's mutating into something that's maybe less virulent than what it was before? Anyone else?
And I'm not the scientist certainly, but what I have seen and heard and read, probably like you, is the European strain is what's been more predominant in the U.S., especially the East Coast, Chicago, Florida. And there is some mutations that cause that spike protein to be much more effective and therefore much more contagious. Whether that's impacting mortality, we don't know. I mean, the demographics are changing. They are younger. We do have more ways to care for these in remdesivir and dexamethasone and convalescent plasma. Of course, hydrochloroquine was a bust. It's not effective. But we're getting mixed results with all these treatments, but at least we do have some arrows in the quiver. So we are hopefully improving on the mortality rate. And there is some speculation that part of that also might be a weakening of the virus. It's not unheard of that a virus, as they mutate, they become less effective.
Wow. Well, I cannot believe, I mean, it's amazing to me how fast an hour goes. This has just been a fascinating discussion. And again, I want to thank the panelists for getting up early and being with us. Justin Librado, thank you for your time. Gay Nord, Don Rudolph, Mark Faulkner, thank you all for your time. I got time for just a couple quick lightning round type questions. And one thing I want to ask, because people have asked me this, and so again, the Brain Trust is here. We talk about the total cumulative number of cases. And again, that's another data point that the media salivates over, but they don't really talk too much about recovery and what recovery looks like. You guys are hospitals. The guy comes in, a young guy, gets COVID. What does recovery look like? And does he still have the virus running through his veins, or is he virus free and back to normal? What does recovery look like? And I'll start out with you, Dawn.
Let me unmute. I'm not a clinician, and so I haven't really researched the recovery. We look at length of stay in the hospital on average, how long are they staying in the hospital? But for that, I think some of the science is still yet to be discovered of the recovery side. And I even wonder, I have children 20 to 30 years of age, if they would contract it, what does that mean for them 10 years from now? I think I don't want to speak to the science of the recovery side of things, because I think it's still evolving, and I've not researched it.
Mark, do you have any insight on Justin?
Yeah, sorry. So I was from the Ascension side. So we have a respiratory clinic. So we take care of drive-through positive patients that don't have to go to the hospital. So
Okay.
we actually have treated a good number of young people. And our main issue is they might feel better in a week, but they're still testing positive for 5 weeks.
Wow. Now let me stop you real quick, because
Yeah.
I'll lose this. Okay, so they're still testing positive 5 weeks later. Are they still contagious 5 weeks later?
So our doctors, is still to be determined, but we tell them to treat it like they are. So here's our main issue. Your example, the 25-year-old triathlete.
Yep.
I'm not as worried about his health as much, but we're trying to educate him of, don't get your at-risk family members sick. And that's been the biggest issue in the last week that we've seen is these younger people, yeah, they're going to recover faster, but we're seeing 4 to 5 days later, a parent or an ill sibling that's coming in and being tested. But the recovery on the outpatient side at the respiratory clinic is pretty short for the younger people. But, you know, for the over 65 population, it's a 2 to 3 week process on average.
Wow.
Of just feeling bad. You know, they're not at the level where they have to go to the 3 hospitals.
Well, Gay, I'm gonna throw this question to you, the same kind of thing, because it's a fascinating question. I've asked it just about every time I've had any hospital-related guests about it, because I'm very curious about recovery and what that looks like long term. And I guess it sounds like there's still a lot of unknowns. But taking it back to the early 80s when AIDS came out, before they had the drugs, it got to a point where some folks would purposely not test because they didn't want the scarlet letter. They did not want to know. Is this going to translate into that? Because Justin just said some of these guys are testing positive 5 weeks later. We don't know if they're contagious. Is this the new scarlet letter where people don't want to know? If they're asymptomatic, they don't want to know because they don't want to be stigmatized, not be able to get a job, not be able to work. What would you say to people who would ask that question?
So Commissioner, I apologize, but I didn't hear the question that you cut out when you were asking the question. Could you repeat it, please?
Oh my gosh, I'll never be able to get that out again the way I did.
Sorry.
It was a masterpiece. No. In a nutshell, when AIDS started, there were folks, as it developed before they had the cocktail of drugs to treat it, that would not go get tested purposely because they did not want to be stigmatized. They didn't want the scarlet letter, for lack of a better word. I'll just use that word. And so now when we're hearing from Justin and others, and I'm reading stuff that we really don't know how long it takes to get this out of the system. For some people, 5 weeks, 6 weeks, are they still contagious? We don't know. Do you think we're going to have that same syndrome where people don't want to get tested because they don't want to know, because they don't want to have a hard time getting a job? Are we going to have the same kind of issues there?
So we do see some hesitancy to be tested, even in our, even today, whether that becomes a stigma or, it rises to that level, I would hope not. I think this is so much of what we're talking about is definitely educating the public. I don't think we can educate enough. There's a lot of misinformation out there. We don't have all the answers at this point, but I would hope that we don't, that it does not rise to the level of what you've just described. And I certainly, as an employer myself, just because you have the flu antibody or the COVID-19 antibody is, certainly would never preclude you from getting a job. So, I would like to think that we're not going to have that kind of reaction to this. And I think we just have to continue to educate around that.
Well, Justin or Dawn or Mark, once you catch it, say I catch it, I get tested, I stay home for 2 weeks, whatever, I feel better, I go back to work, I guess. Could I go back to work if I still have it in my blood system? I don't know. But a year from now, do I have any kind of prophylactic effect from being infected now? Is there any kind of a carryover? Do we know?
We don't know yet. Unfortunately, typically when you acquire a virus, you build antibodies. Those antibodies do translate to some immunity, whether it's 6 months or 6 years or a year. We don't know yet. And we're researching that very answer because to your point, to your question, instead of a scarlet letter, it might be a get out of jail free card. You've tested the serological test, you have the antibodies, and therefore whether you're a student, whether you're at work, if it is proven that it does generate some immunity, it's actually the opposite. People should seek it out to have that validation.
Well, guys, I can't believe an hour is gone. And to the folks that are watching on Facebook, I'm sorry, I got inundated with questions. I didn't get to any of them. But I had a lot of questions that were given to me beforehand right here. And I've gone through just about all of them. If I didn't get to your question this time, I'll submit them in writing to my panelists. I don't know if I'll get an answer back, but I do appreciate each of you. And I want to recognize each of you: Justin Labrado from Ascension, Mark Faulkner from Baptist Healthcare, Gay Nord from West Florida, and Dawn Rudolph from Ascension, and also Janice Gilley. And to the healthcare professionals, would you please just express our deep gratitude to your workers, the men and women, the doctors, the nurses, the support staff. What you guys do is just so vitally important. And you see the heartbreaking stories of people, and they're separated from their loved ones who are in these circumstances, and you guys are the lifeline. So from my perspective, from this person, I just want you to let your staff know how much I appreciate what you all do. And thank you for joining me this morning. A great conversation. Thank
It
you.
was a pleasure. Thank you.
Thanks
Appreciate
for
it.
having us.
Thank you.
All right. You guys have a good weekend. Have a happy 4th of July and a safe one.